we invite you to the knowledge session. Our chief speaker is Mr. C.G. Prahadadra. Okay. Just I'll
Recording in progress.
Will you brief resume of Mr. Prahadadra, who is already familiar with most of us. Okay. I think last session also it has been done. I think now we'll take that just a brief resume. I will repeat. His academics are MBBS from Mysore Medical College, 1979. FCCP College of Chest Physician, New Delhi. Sports Medicine Program, University of New South Wales, Sydney, Australia, 2005. Professional course in Clinical Procedures, Melbourne, 2019. Now profession, practicing family physician since 42 years with the Jayapadma Clinic, Tilak Nagar, Mysore. And his hobbies are very interesting: cycling, trekking, singing. And personal life, he is married to Madam Srimati Mangala Madam. Daughter Shamla, she is also doctor in hemo-oncologist, NHS, Leicester, UK. Son-in-law is Mr. Kandesh, radiologist, NHS, UK. Son is doing engineer, Mountaineer in Mangalore. And his greatest accomplishments are, he is known for as a COVID warrior, treated approximately 6,000 COVID positive cases, and honored as a Corona warrior by Mysore Mayor Sunanda Palanetra and Mysore Police Commissioner P.S. Chandragupta. Awards: Visishta Chikitsa Medal, Nupasri Award, Corona Warrior Award. And social media, he is also very strong in social media presence. He gave many YouTube videos in Kannada for common public health awareness. Honored at the BGS Apollo Hospital and the Narayana Multi-Specialty Hospital, Mysore. I think with this brief introduction, I request Mr. Prahadadra ji just to take us to the knowledge section, please. Thank you.
Shubhodaya, Namaskara.
Namaskara.
First of all, I thank the organizer, particularly Dr. Devaki Madhav, for giving this opportunity for stand before you. So I am Dr. Prahadadra from Mysore. Today I am going to talk on impact of pranayama on cardiovascular system. So you all know this pranayama. When you do pranayama, it increases the oxygenation in the body. So whenever there is increase in oxygenation, the heart rate comes down and the respiratory rate comes down, and the patient feels very comfortable and healthy body and mind. There are so many conditions of low oxygen levels, hypoxia we call it. Particularly those who are having respiratory problems like bronchial asthma, COPD, chronic obstructive pulmonary disease, and interstitial lung disease, high altitude like mountaineering and all, we get very low oxygen and hypoxia occurs. So whenever there is hypoxia, to get sufficient oxygen, the heart has to pump more. So the heart rate increases. Respiratory rate increases. I think you might have experienced while climbing the mountaineering or hilly areas. In that case, you will have breathlessness, palpitation and all. That is, to increase the heart rate, it will increase the heart rate and causes sufficient oxygenation. But at the same time, this increased heart rate and increased respiratory rate causes lot of discomfort to the body. So, with this background, I am going to talk a little about the pranayama and its impact on cardiovascular system. Pranayama. Prana means life or breathe. Prana means vayu. Ayama means rhythmic. So, rhythmic breathing is called pranayama in nutshell. So, before going to pranayama, I am going to give little bit about the little anatomy and physiology of blood vessels and the heart. I will share the slide. Can you see the slide?
Yes, sir.
Yes, sir.
Impact of pranayama on cardiovascular system, today's subject. So you can see here Shiva meditating. That means the meditation and pranayama is not a new one. It's age-old Purana practice. So that gives a lot of strength to the body and the mind. So today I am going to highlight this, I already told, a little bit about anatomy and physiology of blood vessels and heart and its applied aspects and causes of hypoxia and symptoms. Carbon dioxide and oxygen gases exchange at alveolar level. How it happens, I am going to highlight a little bit things. And there are so many types of pranayama, I am going to highlight it. And after that, pranayama, there are 8 types. Out of that, I am going to highlight little bit about Kapalabati on cardiovascular system. And contraindication of pranayama, where you should not do pranayama also I am going to tell. This is the cardiovascular system. You can see the heart in the left side of the chest wall and the vessels. And here this vein and the artery. The red one is the artery, blue one is the vein. And there is interconnection with that is we call it as capillaries, wherein the oxygen and carbon dioxide exchange occurs. I am going in detail next in a few minutes. As you all know, the red color of the blood is due to hemoglobin. Hemoglobin is present in red blood corpuscles. You can see the red blood corpuscles here. It is a disc-like biconcave. That is, the center is depressed, biconcave. Why it is biconcave means it increases the surface area for the oxygen absorption. And whenever there is anemia or deficiency of the blood cells itself, in the right side you can see the normal RBC, macrocyte, microcyte, different types of this one, and spindle shaped like that. So in such case, the carrying capacity of the hemoglobin for the oxygen is very less. There also you will have breathlessness and increased heart rate. Even in anemia also there is less of RBCs and they will have breathlessness. And there are many hemoglobinopathies wherein the molecule of hemoglobin itself is abnormal, like thalassemia and sickle cell anemia, and hemolytic anemia wherein the blood ruptures, and nutritional anemia, that is iron deficiency anemia, folic acid deficiency, like that. I think it is better to mute all other things, only when. So, now we are coming to the hypoxia, that is low oxygen level. What are all the causes? Anemia, asthma, bronchitis, COPD, congenital heart disease, wherein the left and the right heart connects because of the so many ventricular defect, ASD, VSD we call, congestive heart failure, that heart actually swollen and the capacity of the pumping capacity of the heart is very low, congestive heart failure, emphysema, that is lung disease, pneumonia and high altitude. So, coming to the symptoms of hypoxia, usually it is restlessness, severe headache will be there, vomiting sensation, nausea, vomiting will be there, lot of confusion is there, anxiety, And I think most of whenever you go in the hilly areas and high altitude, these are all the common things to experience. And there is increased heart rate, we call it as tachycardia, increased breathing rate, that is tachypnea, difficulty in breathing, and shortness of breath, that is called dyspnea. Shortness of breath means whenever you walk even on a horizontal level, you feel very difficulty in breathing, that is dyspnea. Coming to the anatomy, little bit, I am not going to in detail. So this is the artery. Artery has got 3 layers, and within the lumen there is a lining. That lining we call it as endothelium.
Three, 1 plus 2. So
3
this
and
becomes
1 and 9.
3 into 3. That is.
So this is the endothelium. Can you see the cursor here? Computer cursor, can you make out? This innermost is the endothelium. So endothelium character is, if the endothelium is healthy, you will also be healthy. So whenever you take deep breath, it increases the oxygenation, and from the endothelium, because of the oxygen, it secretes nitric oxide. Nitric oxide actually it dilates the blood vessels and it prevents the platelet aggregation, like that. So it prevents blood clot, everything. So to prevent heart attack or this one stroke or thrombosis, so only thing is to do the regular aerobic exercise, or those who are elderly people, they can do pranayama in their house by sitting on the chair itself. So that prevents the blood clot by secreting the nitric oxide whenever there is increased oxygenation. Okay. And if you are having any doubts in between, you can ask immediately so that I can explain with these slides. So nitric oxide is a physiological compound of human body that dilates the blood vessels, stimulates the hormone release, regulates the neurotransmission, acting as a signal molecule. So naturally, how can I increase the nitric oxide level in my body? So you have to eat plenty of vegetables and increase the amount of antioxidants absorbed into the body. That
Sir, I have a question.
yes.
Why mouthwash solution is bad?
Yeah, I'll come to that. So increased amount of antioxidants also causes less number of nitric oxide, and using nitric oxide boosting supplements. Limit the use of mouthwash solution. Mouthwash actually is an antiseptic, oral antiseptic. So it kills the bacteria. Actually, normally in all parts of the body, including the skin, gastrointestinal tract, we are having microflora, that is normal, helpful bacteria that synthesize the vitamin B12, and it is more in large intestine. I think you might have heard probiotics. So this probiotic is also there in the mouth, that helps in synthesizing vitamin B12, and that gives a very good condition for the RBCs, and it improves the health of the RBCs and hemoglobin carrying capacity. And exercise helps blood circulation. As I already told, whenever there is increased circulation and oxygenation, it increases the nitric oxide production. So I have shown this here. This is normal blood vessels. You can see the lumen is very clear, very smooth, and the RBC is flowing smoothly. Here, that yellowish lining, this is the cholesterol deposit. And whenever there is cholesterol deposit too much, it narrows the lumen of the artery here. This we call it as plaque. So when this condition is there, there is less amount of blood supply to the vital organs like brain, heart, lungs, etc. So naturally, whenever there is low blood supply, there will be low oxygenation, and patient feels discomfort in the chest pain, sometimes even profuse sweating, everything will be there. In such condition, when he lifts, if there is any stress condition or when he lifts the heavy weights, sometimes this plaque ruptures actually. It ruptures and the contents goes forward and blocks in the smaller arteries and capillaries and coronary arteries, causing the sudden heart attack or stroke like that. The same thing is depicted here also. So this is about the blood vessels. Here you can see the normal heart. The size of the heart is usually the size of the fist actually. So you can over the heart you can see the blood vessels, that is coronary arteries. There are three main coronary arteries. I will come to that later. And when you do the cross section, it looks like this diagrammatically. So all deoxygenated blood, that is impure blood, all over from body, it will be collected through the inferior vena cava and superior vena cava and enters the right atrium here, right atrium. From the right atrium, it enters the right ventricle. From the right ventricle, it enters the pulmonary artery. So this is the pulmonary artery. So this pulmonary artery rises from the heart, that is why it is called as artery. But though it is pulmonary artery, it carries impure blood. All other arteries carries pure blood or oxygenated blood. On the left side, you can see the left atrium, and from the left atrium, and you see the pulmonary artery supplies, goes to the lungs and gets the oxygenation of the blood, and it enters the left atrium and then left ventricle, and from that ventricle it enters the aorta and supplies all the organs. And this is the coronary artery. You can see the right coronary artery, left coronary artery and left circumflex artery. And this artery originates at the base of the aorta. So this is about the cardiovascular system. Very little bit briefly I am telling. And regarding the respiratory system, you can see the both right and left the lobe situated within the rib cage. Rib cage actually it protects the lungs from external injury. And you can see the mouth, larynx, trachea, and I think all of you know. The rightmost is the alveoli. The terminal, usually the first trachea divides into bronchus, we call it as bronchus, and later on bronchioles, and bronchioles later on end up into the alveoli. Alveoli is very thin membrane sac-like structure, whereas lot of capillary supplies will be there, and that helps in exchanging of carbon dioxide and oxygen. So now I come to the how oxygen and carbon dioxide exchange occurs in the alveolar cavity. So this is diagrammatic representation. Whenever the blood enters the carboxy, that is a deoxyhemoglobin, that means impure blood enters the lungs, the carbon dioxide present here in the blood enters the alveoli, that will be exhaled out, and whatever the pure oxygen is there in the taken this one alveoli, that will be absorbed to the blood again, and that is supplied. This is how the carbon dioxide actually, when for gases exchange, there should be a liquid base, and this alveoli is lined by a very thin membrane, single layered membrane, and that is supplied by lot of blood vessels, capillaries, and this alveoli is lined by a moisture that is called surfactant, that helps in absorption of the carbon dioxide and this oxygen. Here this is pressure gradient. Whenever there is increased oxygen, it diffuses into the lower gradient level. So whenever there is low gradient in oxygen level, it absorbs. So carbon dioxide is exhaled out and oxygen is taken inside, and this oxygenated blood is supplied, as I already told, to the all parts of the body. This is little about the anatomy and the physiology of the blood vessels, heart and lungs. So coming to the pranayama, with this background, I will not go in detail for everything, every type of pranayama. That will be dealt by some other speaker. So you can see the Brahmari, Kapalabati, Bhastrika, Nadi Shodhan, Shitali Pranayam, Ujjayi, Anuloma Vinoloma and Shitkari Pranayama. With this, I am going to explain in detail how Kapalabati increases the oxygenation. See here, Nadi Shodhana Pranayama, it is there. Nadi means blood vessels. Blood vessels will be clear with this pranayama. And almost all pranayama, it increases the oxygenation and circulation. And there are different methods, that's all. Kapalabati, that means skull polishing. It's an important satkarma, a purification in Hatha Yoga. The word Kapalabati is made up of two Sanskrit words. Kapala means skull, Bhati means shining or illuminating. That means by doing Kapalabati, the lot of blood supply to the brain, and brain will be stimulated and illuminated like that. And this is how you do the Kapalabati. In Kapalabati, what we do is we take air, that means we inhale very slowly and then exhale very fast. So during exhalation, so you can see it in the photograph, the abdominal muscles contract here, and at the same time diaphragm goes up. All chest muscles contract, and even neck muscles also contract. That helps in squeezing of the lungs. That helps in exhaling the air very fast, completely. So usually in normal breathing, only 20 to 30% of the lung tissue expands. But in pranayama, where we take very deep breath in and exhale out, almost the air enters to the terminal part of the alveoli in almost all the lobes of the lungs. That's how it increases the oxygenation. So what happens when you do Kapalabati? For 1 hour, Kapalabati stimulates brain nerves, which aids in the well-being of the brain. The stimulation energizes and helps declutter the mind. And it gives a sense of balance, sense of well-being, and it improves the memory, concentration. It prevents even getting dementia, Alzheimer's disease, Parkinson's disease, because it increases the oxygenation. And of course, all types of pranayama, the effect is same almost. And even in Kapalabati, when you contract the stomach and exhale it fastly, it gives lot of pressure over the pancreas and tail of the pancreas, that wherein the insulin secretes through the beta cells. We call it as cells of Langerhans, beta cells of Langerhans. That's how it reduces the level of blood sugar if there is diabetes, or if there is no diabetes, it prevents formation of the diabetes. Daily practice of pranayama, any type of pranayama, that helps permanently decrease the blood pressure, heart rate, that I already told, and heart works slower, and wear and tear also reduce. And usually pranayama is for the healthy people. And those who are having some of the problems, they should not do. I will come to the contraindication later on. Now coming to the Kapalabati benefits, it increases the metabolic rate and aids weight loss. It enhances the capacity of the lungs and make them stronger. Clears the nadis. Nadi means blood vessels. So whenever there is increased circulation, naturally whatever that cholesterol deposits in the wall of the lumen of the artery, that clears, and if, because of the warmth developed, that dissolves actually. So that helps in maintaining the very good circulation to the heart as well as the brain and other vital organs like kidney, lungs, etc. It stimulates the abdominal organs, thus is extremely useful to those with diabetes, I have already told. It improves the blood circulation and adds radiance to the face. What is radiance to the face? Ojassu, tejassu, like that. And when there is ojas and tejas in the body, it increases the ayassu also. Ayasa means life. So whenever there is increased blood flow, it helps in secreting the nitric oxide, which improves the endothelial lining, and endothelial health also improved, and prevents blood clot and delays atherosclerosis. Atherosclerosis means the artery becomes hard, it is get calcified, it becomes very stiff, and the inner lumen is lined by the cholesterol. That is atherosclerosis. And whenever there is cholesterol deposits inside the lumen narrows, and that causes hypertension, that is increased blood pressure. So that also prevented here. And contraindication for Kapalabati. So not advisable during stress condition. Usually by doing pranayama or any other, not only Kapalabati, any pranayama, the stress will be relieved. But it is not advisable during severe stress. See, there are stress means eustress and distress. There are two types of stress. Eustress, even going to the college and studying in the college, reading the books, doing the homework is also a stress. That is eustress. That gives a good result. Whereas distress, whenever you lose your loved one or any accidents like that, distress causes illness and detriment to the heart and the brain. In such condition, you should not do Kapalabati pranayama. And it's also contraindicated for individuals with high blood pressure, heart disease, hernia, gastric ulcer, epilepsy, vertigo, means that is giddiness. And whenever there is nose bleeding, that is we call it as detached retina. Glaucoma means increased pressure in the eyeball. That is one of the condition wherein you will get sudden visual loss. And any recent abdominal surgery or any stroke like that, this wherein you should not do Kapalabati. And this contraindication is applies to all types of pranayama, and particularly pregnancy. This is also contraindicated. And during pregnancy, there is very simple methods of pranayama, and that will be dealt with your yoga teacher. And with this, I conclude my talk. So I have told little bit about anatomy, physiology of blood vessels, and its applied aspects, causes of hypoxia and symptoms, and how carbon dioxide and oxygen gas exchange at alveolar level and its benefits, and little bit about the nitric oxide, what are the benefits of nitric oxide, pranayama, and among pranayama I will explain little bit about Kapalabati, how it helps in cardiovascular system, and contraindication of pranayama. Thank you.